Hey everybody, my name is Ben Calderwood. Thanks for joining us once again on the World Health Network broadcast. We're doing a sort of, let's call it a recap and an update as well today on the status of our current COVID surge, as well as a discussion about CDC's recent ACIP meeting. That's the Advisory Committee on Immunization Practices and all the fallout that ensued following. As always, if you're inclined to give this video a like and subscribe to the channel, that'll be a really big help. So thank you kindly for that. We have some return guests on the channel today. We're joined once again by Dr. Joe Eastman, he of the MAPS COVID forecast, as well as WHN COVID forecast, and of course by Becky Robertson. She's doing research for WHN. She's been on our channel before talking about her experience with long COVID and long COVID advocacy. That was a long sentence. Thank you guys both for joining us.
Thank you for having me.
Yes,
Dr. Joe, thank you, Becky. Let's get started with you and let's take a look at your data. And here we are, we're recording this just about in October as we head into fall. Some of us think that we're on the tail end of a surge, but let's take a look at the data and see what it's telling us.
All right. This is an updated map or a plot that I showed last time. You'll see a lot of curves on here, so I'll walk you through it. The blue line is the WHN new daily infections estimated from the National Wastewater Surveillance System data. And it goes right down to the county level, and then we aggregate it up to get the United States totals. And you can see the blue line here. We just passed the peak of our surge. And I also got the MAPS forecast in the kind of purple line here. You can see that this three-month-old forecast has got the peak timing a little bit off, but in general, it did a pretty darn good job. I also put on there the 2023 new daily infections in the gray curve here, because you'll notice that both the model and the 2025 data follow closely to 2023, which was an interesting year because that was a year of a lot of recombinants. So currently, we are in a phase of recombinants at the moment. I expect to have an updated 4-month forecast in probably the next time we meet, and it will go out through February, so people can kind of see what's coming along for their vacations. The next slide, whoops, is our state data that we've broken down. And this again is our WHN wastewater-derived new daily infections. In the top, we got Massachusetts. Below that, Pennsylvania, New York, Delaware, Connecticut, and Massachusetts in the upper right. You kind of see a rather concerning pattern developing because where the national peak had already occurred right around the start of this line, just before it, these levels they've kind of leveled off, and this data will fill in. If you go up to Massachusetts in the upper right, you can see it's increasing during our preliminary estimate phase. Delaware is also leveled off. So we have kind of a mixed bag going on in the on the East Coast right now, but in general, there's a tendency for either leveling off or increasing. We then move to the Midwest, and we have Indiana up here on the top left, Missouri, Nebraska on the top right, and Wisconsin. The good thing about this is most of the Midwest has already peaked, and they are in a fairly substantial decline. It will go back down to what people call a baseline, although I'm not a fan of that term. The next plot is for the West, and we have Colorado at the top. Next to that is California, Hawaii, Utah, and Nevada. And you can see the West Coast has a similar trend as the East Coast, where it's pretty much leveling off at a fairly high rate. People need to realize that most of our accumulated infections come on the backside of a peak in a surge. So we're still not out of the woods. I want to emphasize that to people. And then finally, we go to the south, and Louisiana is over here in the lower right, Texas right next to it, Oklahoma, Virginia, and North Carolina in the upper right. This also shows a kind of a mixed bag where we got two of the states clearly coming down. Louisiana's coming back up out of their peak. And you can also see that Virginia and North Carolina have essentially leveled off. The key point is when we look at this, these values tend to fill in a little bit more. Rarely do they go down. So again, I want to emphasize we are not out of the surge at all. And I just wanted to let people know that the top variant in circulation is XFG, and then XFG.3 and NB.1.8.1, which was originally back in the early part of summer, pretty much neck and neck with XFG. And then in fourth place, we got XFG2. The XFG strain has really taken off. There are now 107 sublineages, and people referred to that before as stratus. Nimbus is NB.1.8.1. So that's kind of a summary of what's going on. We will also be adding some other countries to my forecast coming up in the near future. And I'll give some variant updates and wastewater updates for other countries as we move forward. Thank you.
That's great. Thank you, Joe. I wanted to ask if I could just a couple of follow-up questions. You mentioned at the beginning of your presentation that we're in a period of recombinance. I wanted to kind of follow up and ask you to explain a little bit. You mentioned, of course, numerous variants. Tell us a little bit about what that means to be in a period of recombinance and how that, what impact that has on your data and on those graphs that we're looking at.
Yeah, a recombinant is if a person has two different viruses at once,
Hmm.
two different strains of COVID, they recombine with each other and form these recombinants. If you go, I don't know if you remember, but if we go back to 2024, last year, we had the second highest peak in summer, and that was a novel lineage that was started back then. And we peaked at almost 3 million last summer, and it started really early. That's another point I want to emphasize is the temporal patterns are going to become very regionalized. And if you look at the United States, you'll see several, maybe one maximum peak and then several secondary maxima that follow, and that's because different regions have a different memory of what infections they've had, mitigations, population density, all these factors, weather. So they're peaking at different times, and cumulatively they tend to add up in the regional on a regional basis.
You mentioned that our current data is tracking closely with the year 2023. I'm curious to know if at this point you're able to extrapolate and speak a little bit about what a possible winter surge might look like based on the information you have now. Do you anticipate that to be similar to 2023, or is it too early to make assessments like that?
Yeah, it's really tough because in 2023 we had the introduction of BA.2.86,
Hmm.
which became our JN1 strain, and we had that's when we had a pretty substantial winter. If we don't have a novel virus pop up, we should be okay in terms of somewhere around 1.2 million new daily infections by the end of the year. And I want to emphasize that people need to realize The first major peak we had was in 2021, and we hit approximately 400,000 to 500,000 new daily infections. So we're constantly hovering above 1 million. And if you think about the long COVID accumulation and the cost of healthcare, et cetera, it's not a desirable situation.
This is, if I may perhaps be a bit presumptuous here, why the term baseline is perhaps a bit bothersome to you, I think, because at this point, our baseline for infections, if I'm understanding this correctly, is well above some of our surges early in the pandemic. And I think it's important to frame conversations about new daily infections and virus levels with that in mind, right?
That's correct. People get used to these numbers when they see them now, and they have to put them in perspective, and that's why I did put the other years in the graphs to
Hmm.
give you an idea of different times a year too that these peaks can occur.
Thank you, Dr. Joe Eastman. Bearing all of these challenges in mind, understanding that regionality plays a huge factor here, Becky Robertson, let's turn to you and speak a little bit about that ACIP meeting, the CDC Vaccine Recommendation Committee. If, as usual, we are encouraging people to get vaccinated against COVID, let's talk a little bit and recap what occurred at that meeting and what people should be thinking about when they speak to their doctors and ask about vaccination for.
First and foremost, I would have to say that talk to your doctor. Talk to your doctor before you do anything, because currently not all the states are on the same page, so that makes it a little difficult. Some places require a prescription from your doctor, whereas other places you can go in and let them know that you're ready. This is making things extremely frustrating. And that caused a lot of problems at the ACIP meeting. And ultimately, they decided to go ahead and separate as far as the age is going to be a lot of this, you have your own autonomy, but instead of 65, it's going to be 75. So 75 and older, it's going to be, you pretty much should, it's your choice, but you should get your vaccine after age 75. Now, as far as children and adults, it's up to your discretion. There are certain states that they recommend going against the ACIP and adhering to the American Pediatrics Association. So a lot of this, you're going to have to do your research. You're going to have to talk to your doctor. There's just not a concrete answer to the question. Uh, I would like to say that it's very easy. Now, I will say this is good news, that we did have Novavax come out yesterday. So you have a third option. And we have the Moderna, the Pfizer, and now Novavax. And that is something we've kind of been waiting for. And everyone likes choices. So yes, go to your nearest. There's CVS, Walgreens, and Costco are your primary distributors. Again, call in advance just to make sure. We know how communication goes. So as it goes down the line, it's a hard decision for a lot of people to make, but it does cover this year's variant, which is most important. From what I understand, Novavax does a little better job, but either way, you're protected. I often ask Joe for his opinion and the variant to make sure that it always matches up. So if I can ask Joe for a moment, Joe, what do you think about the vaccines this year and whether or not they match up?
Yeah, the Novavax is still based on JN.1, which is about 2 years old. While the other ones are based on LP.1.8.1. The scan amount of data I've seen does indicate that the Novavax is more effective against the variant that Moderna and Pfizer were both based on. So that gives you an idea how protective, and that's the old protein-based vaccine type, whereas the other ones are messenger RNA. So they're delivered in different ways, but it appears the Novavax is slightly better. And I leave that up to people to make their own choice.
Becky, you mentioned a moment ago, of course, that people are going to have to do their research, considering that we're in a bit of a sort of patchwork circumstance in terms of what certain states are recommending. Can you speak a little bit about people who are following this, COVID conscious folks, hopefully other folks who are interested in staying safe and getting vaccinated, or staying safer, I should say, and getting
Yes.
vaccinated this fall and this winter? Talk a little bit about these health alliances that we're seeing pop up, like on the West Coast, California, Oregon, Washington State, Hawaii, over in the East Coast as well, and what they're trying to do relative to federal recommendations coming out of the CDC.
Currently, the CDC has not quite adhered to our previous guidance. So like I said, American Academy of Pediatrics and various medical, the American Medical Board, they've all kind of come together and on their own made their own recommendations. And insurance, this is a good part. Insurance is pretty much adhering to the guidelines of the AMA. I mean, and why wouldn't they? So for the most part, as far as until we know otherwise, insurance is going to cover this. But we'd like to follow the science, and that's why they're putting a lot of onus, I think, on the average everyday person. This is really a difficult decision to make. So and it's unique. It's a unique circumstance this year. We've never faced this. There are some other changes in the other vaccines as well. The COVID vaccine, like I said, up to the individual. My advice, not medical, I'm gonna opt for the vaccine this year. I would prefer to take my chances. I don't want to get COVID, and neither do I want my family members. Um, uh, as far as all of the rest of our vaccines and the schedule, we do have a whole table we're putting in our newsletter. So I would encourage you to read that because it breaks it down state by state, the various rules, what doctors recommend, and the ages. So that makes things really clear. If I were to tell you state by state, we'd be here, for 50 more minutes. But the rest of our shots, if you're interested, as a mother, it's pretty important. What am I going to do with my baby? So we're going to change it now and mix it up a little bit. We're doing the and we're taking out the RV. So
By
what
we, apologies for interrupting. By we, you mean the CDC's updated
yes,
recommendation.
but yes, the CDC, the American guidance.
Yeah.
Yes, we
Federal
are.
level vaccine recommendations for MMR and varicella. Yes, understood.
Yes. Now, I can't guarantee that this isn't going to change a week from now, but currently, as we understand it, they're going to separate that and they're going to make the MMRA something that you do. You're going to do the MMR first, V at the very end. Is that correct, Joe? I think that the varicella is the one that's
I
been.
think that's the separated one. Yeah.
Yes, yes. Which is to be seen. Anyways, they are currently, yes, the varicella is off to the side until you're 14 and above. I do believe we have a little choice. The rest are going to be MMR for children 6 months and older. That's pretty consistent with what we've been doing in the past. There are let me see. I took a lot of notes here during the meeting. So we do have a couple different things going on too that normally there are so many vaccines. This is making it even more convoluted, and the government's not helping. So amongst all of these choices, as adults, right now we're facing some other vaccines, and these are yearly adult vaccines that they're recommending now. I don't know that they recommended before so firmly, but this year we are going to go with pneumonia. They would like you to be current on the pneumonia, adults 20 years and over. A wise decision. Then they're going to do the let's see. Oh, I forgot to tell you. One good note is that Walgreens, CVS, etc., and there will be available tents for vaccines as there were before. It's free. So we like that. It is free. So the ACIP meeting has changed the COVID recommendation to individual shared clinical decision-making. Consult your doctor, and if you'd like to do your own research, of course, we've got it at the tip of our fingertips. We've also got information on our website. But this is more of an individual choice, no mandates. Most insurance companies so far have said that they're going to pay for it. So there's no longer the blanket, you should get it recommendation. But again, immune compromised and those who are older are recommended. By older, I mean 65 plus. ACIP recommending toddlers through age 3 to get the chickenpox as a standalone vaccine at the time of your MMR visit, rather than using the combo MMRV. There has shown to be some the possibility of seizures, a very remote possibility, like 1.1%, right in there. But for the most part, it's going to be the same. It's going to be kind of a hassle to go in twice. I don't know why we're going to change it up for mothers, fathers, just parents. It's really difficult to come in and not very convenient to come in time and time again, take off work. That's really an issue.
These new recommendations certainly present roadblocks for some people. I think that living in the country that we do, where our health system is pretty fractured, even before these specific recommendations, we talk a lot, as you've been talking during our discussion today, about, you mentioned it, shared decision making, the need for certain individuals in certain states to speak with their doctor before they are able to procure a vaccination. That works for individuals who do have primary care doctors, and of course, many people do not. We might be able to suggest things like, in your particular state, when you need to do your research, simply Google your state and the vaccination you are looking for, possibly the state health department, possibly the AMA, the American Medical Association that you recommended a moment ago, Becky, to give people a little bit of a head start on the research they may need to, the time they may need to put in online in order to figure out what is available to them and how they should proceed in terms of getting vaccinated.
Certainly. And I do believe that we're going to be putting the information up on the WHN.global
Great.
website as well. So you can use that as a resource. And they're going to keep it up to date as things fluctuate, as you know that they do right now. Let's see. We've got also the Hep B. That is usually something that they gave at birth. And that's one that they kind of left it up in the air and are going to discuss at another time. As far as I know, you can still get one. See, another thing, this is, how our healthcare system is, it's not consistent. So although we're going to proceed as usual with the Hep B shot, you can count on them giving you concrete recommendations at a later time.
One thing I would like to add is they've shown now that in adults that are older, 65 and over, but actually about 50 and older, the mumps, the MMR vaccine is waning. Um, and it's recommended by many that adults get a kind of a booster shot for that. It's crucial because when you think of what if you do get the measles, what happens is up to 78% of your immune system's memory can just
Resets.
vanish,
Mm.
and it leaves you exposed.
That is a very good note. And I remember hearing about that and learning about that during our recent measles outbreaks as people being very concerned about the potential for that in older individuals. So,
Yeah, and the United States just crossed 1,500 measles infections this year. So it continues to rise.
hmm hmm. I think I don't want to leave anything out. I think we're sort of cruising towards the end of this discussion. Becky, did you want to add anything?
I do want to throw in that the recommendation for the flu, pneumonia,
Mm,
please, 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 I'm encouraging you to get the flu and pneumonia shots. I didn't do it in the past, as far as the pneumonia. I didn't know it was an option. So I would definitely recommend that, especially with all of our respiratory illnesses going around, because we've got our RSV and pneumonia already starting. So that's something to be concerned with. So that's it. Like I said, state to state, again, refer to our website. I'm sorry, it's so confusing, and I'm trying to make sense of things that don't make sense, Ben.
But we're gonna link to all of the things we've discussed today. Of course, Joe will link to the MAPS forecast. We'll link to the WHN forecast, Joe's Substack. We've linked, of course, to Dr. Eric Feigelding's Substack in the past as well. All of the web pages you mentioned, Becky. You did mention that you're working on getting this information in the newsletter. We don't have an ETA for when that will be available in newsletter form?
I want to say that we're putting it out tomorrow.
Oh, great.
It
Okay, that's
will
really great to know.
certainly, I believe it's going to be a little separate addendum,
Got it.
so that if you want to print it out, put it on your fridge, it's easy to forget the timing. But yeah, the information is going to be readily available to you. And
Excellent.
again, talk to your doctor if you've got a family doctor. We've run into a couple of problems that I'd like to mention real quick, in case anybody else runs into this. Yesterday, we had some people documenting that they went to their pharmacy, and these are in state New York. They changed the rule, and anybody can walk in and get it and covered, their vaccines. And because of the miscommunication, the pharmacist refused to allow them to get one without a prescription. So I don't know that the information is reaching the pharmacist quite yet. And I actually recommended to some people, you know what, print it out directly from the CDC if you're up against any resistance, and have that available to you.
I
Just
think that's a very good recommendation. Anecdotally, I have read similar reports of people encountering similar challenges like that. Look, we here at WHN and on the broadcast, I think tend to speak to a relatively medically literate audience to some extent. Definitely to a COVID conscious audience. But of course, a lot of people are unaccustomed to
Mhm.
being put in the position of having to push back against medical authority to get the care that they need. That's a really uncomfortable position for a lot of people to be in. So Becky's recommendation of thinking ahead, being prepared, simply printing out the information for your municipality, for your state, to have it with you if you need it, so that you can be prepared if you do find yourself in an uncomfortable conversation and having to lobby for your own health or that of your family. I want to reiterate that, Becky. Thank you. That's a great recommendation to be mentally prepared as well as literally prepared with that document in your hand. So
Yes, and I can't close out with telling everybody to make sure when you're getting your vaccines that you're wearing a high quality respirator
thank you.
and wearing an N95. If those around you are not, you're doing your part, and keep yourself safe.
And
So
that is
thanks.
layered protection right in that room, getting a vaccination, wearing a high quality respirator. Thank you for that reminder. On that note, I'm going to thank both Dr. Joe Eastman and Becky Robertson for joining us on the broadcast today. Obviously, this is a complicated topic. Obviously, this is something that both WHN at large and we here in the broadcast team are trying to grapple with and trying to present more information about as time passes. So please stay tuned for that here on this channel. And a little bit about the World Health Network, as always. We're a global organization working to end the COVID pandemic as a global health threat. And as you see here, reckoning with ongoing public health challenges in 2025, soon to be 2026, I have to say,
Wow.
and beyond. So please check us out online at whn.global. We hope you'll visit us, we hope you'll visit the website and consider joining us. Thank you so much as always. We'll see you next time.